If you don't already know, primary care in the United States is failing us. But why is that? So what do I mean that primary care is failing us here in the US? Well, the thing is we're getting sicker as a society, so there's more chronic conditions that keep popping up. And we spend a lot of money in the US towards our healthcare system, but our population as a whole is not healthier. And then also primary care doctors are devalued by the AMA, and that's just based on the coding system in which the AMA has developed. Those codes don't value time that primary care takes to be with their patients. And then the other thing is primary care doctors are getting out of the practice. So less students want to go towards primary care, and then also less primary care doctors want to stay in the practice just because of the rigors of it, and also they're not valued for what it is that they're doing. And then also through their schooling, primary care doctors, they are not taught nutrition. And I'm mainly talking about MDs and DOs, or allopathic medicine mainly, which is unfortunate because we know nutrition is the basis for a healthy system when we're talking about our health overall. And then primary care doctors are incentivized to spend less time with their patients, and which is unfortunate because how can you get to know people? Because the main idea around primary care is to build relationship with your patient and be able to see their health from a holistic perspective and really be able to be there for them. And then the other thing is primary care doctors are taught to prioritize specialties rather than seek holistic perspective when it comes to treatment and management. My thing is specialties are very important, and sometimes the primary care doctors doesn't feel it's within their willpower or their knowledge base to really understand what it is that patient is going through. And so they need to refer over to a specialist. But a specialist is specialized in a very particular area or particular system of the human health or the human body. And so because of that, they may lack the holistic aspect of treating that patient. And so for primary care doctors, it's so important for us to be able to have them because they get to see the big picture. They get to see various different components, and they can talk to their patients about different aspects of their life and really be able to come to a conclusion of what it is that they should do next, and not just bounce them around from one specialist to the next specialist, but really getting to the root cause of what's happening. Specialists, they have a place, but a lot of times they might miss that holistic perspective. So this is why we are seeing slowly our society kind of switching over to the integrative medicine. But then also we're seeing naturopathic doctors becoming more prevalent in the US. And the reason of that is because the perspective and also the principles in which naturopathic doctors have is they're trying to get to the root cause of the condition. They're really trying to spend quality time with their patients and trying to understand what it is that is going on, because they really want to emphasize the idea of looking at the whole patient, right? Because there's different systems of the human body, and you have to be able to take all of those into account to be able to come to an understanding or to a treatment plan for that particular individual. And so for me, thinking about what path do I want to go to is like, do I want to go to a naturopathic medical school, or do I want to go towards more the allopathic for medical school? And for me, it starts with the American Medical Association. Okay, so for medical schools, it's run by the AMA. Well, if the AMA doesn't prioritize primary care, why would I spend my time going into an institution that devalues what it is that I am trying to be? That doesn't make any sense. And also for me, the big thing was nutrition. That's such a key component of our health. And there's a lot of studies that says, our nutrition is probably some of the factors that it's having an impact on our health overall. And so it would be nice to really get a good understanding of that type of teaching so that I can be able to help future patients and so forth. And so for me, as I progress into this next season of my life to Bastyr, I'm excited to see that approach a little bit more, and also to kind of understand the principles and the values in which they have within that schooling. And so thank you guys so much for watching. And something I like to say is movement is medicine, but movement with a specific purpose allows us to get a specific outcome. If we move to understand the different type of primary care doctors here in the US, we might shift our perspective and go to the right ones and the ones that are really going to value our health overall. Thank you guys so much for watching, and I'll see you guys next time.